Well, colorectal cancer is the second leading cause of cancer deaths among women and men combined here in the United States. You know, it was once thought that this was something that mostly impacted older Americans, but the American Cancer Society just released a report saying that is changing and changing fast. And one Twin Cities woman I spoke to is living proof of that. The signs were subtle.
It was the summer of 2019. I was having some minor pains and I ended up going to the doctor.
The timing wasn't great.
I was 34 years old. I had a 1-year-old and a 4-year-old at the time, and we had just moved back to Minnesota.
But when it comes to cancer, especially colorectal cancer, the when, the how, and the why often defy our own understanding.
I found out that I was diagnosed at stage 4, which means it was metastatic and it had gone to my liver. So when I first got diagnosed, I had a mass in my colon and I had 15 tumors in my liver. It was quite a shock.
Bridget O'Brien says since the diagnosis, life has been a roller coaster of ups.
It was an 8-hour surgery, removing a foot of my colon and all the tumors in my liver.
And downs.
3 months later, I had a recurrence. So it came back in my liver. So I had 5 tumors that came back in the fall of 2020.
And then more downs.
Found out in the summer of 2022 that had moved to my lungs. So I had lung surgery in July of 2022.
Bridget's story is part of a larger trend. Colorectal cancer patients are getting younger and younger.
So 1 in 5 people with a new diagnosis of colorectal cancer is younger than age 55. We really need to figure out why.
Dr. Emil Liu with the U of M says family history doesn't seem to play a major role. Less than 10% of cases are linked to that.
People with who are smokers may drink a lot of alcohol or eat a lot of processed or fried and fatty foods, if that's the majority of their diet, will be at increased risk.
With this hitting younger populations, it may change how we look at colonoscopies.
The American Cancer Society recommended 2018, and in 2018, the age be reduced to 45. I won't be surprised if the next few years the recommendation becomes 40.
Bridget says she would support lowering the recommendations, knowing that screening saved her life.
Just like you go to an eye doctor or a dentist, you know, I'd love that it could be available for people at a younger age.
Until that happens, she urges you to stay in tune with your body.
Making sure you get checked, go to your annual physicals, you know, talk to your doctor about anything that you feel it is not feeling right in your body is important.
So good news for Bridget. She is fighting back and in the clear as of right now. She still does maintenance chemo and infusions every few months to prevent the cancer from coming back. Now, Dr. Liu, meanwhile, says this is a good reminder. As soon as you're eligible, meaning 45 years old, according to current recommendations, do not hesitate to go out and get that colonoscopy.